I'm Silas, a specialist paramedic in critical care and lead for the Prehospital and Emergency Department ECG course. Over the next few minutes, I'm going to explain the origin of the PhEDECs course, introduce you to how it works, and explain why, at Pre-Med, we truly believe it to be the most valuable ECG course for pre-hospital and emergency department clinicians. Over the past few years, Pre-Med has developed significant experience in ECG education, during which we've noticed some trends in our interaction with learners. One of these is the inconsistency in teaching between universities, medical schools and employers. In contrast to the formal courses for ultrasound, advanced life support, trauma care and others, there exists no standard ECG education course for pre-hospital and emergency department staff in the UK. Furthermore, most ECG courses focus purely on ECG interpretation and do not discuss this in clinical context. We strongly believe that utilising the 12-lead ECG in practice is about more than just ECG interpretation. Clinicians need to understand the associated pathophysiology, signs and symptoms, and treatment strategies as well. These trends reflected our own experiences as healthcare professionals, and as such, we decided to do something about it. Initially, we began by reviewing the standards of proficiency and educational curricula for paramedics, nurses, GP trainees, emergency medicine trainees, and emergency medicine ACPs, and identified the cardiac and ECG related competencies. As a multidisciplinary team of specialist paramedics and doctors, we drew parallels in practice between these different professional groups and developed a list of competencies which we included in our Pre-Med ECG syllabus. Next, we carefully separated these competencies into 4 tiers of ECG knowledge. The ECG Essentials package equips learners with the fundamental concepts that underpin the 12-lead ECG, and introduces learners to the teaching and assessment methods utilised throughout the PhEDECs course. Level 1 aims to ensure learners can systematically identify normal sinus rhythm and can recognise common, life-threatening ECG patterns, ideal for newly qualified paramedics, nurses and doctors, or as revision for those with a bit more experience. Level 2 aims to ensure learners are able to recognise common ECG patterns, critically evaluate them in the clinical context, and provide appropriate care. This is aimed at experienced healthcare professionals and medical staff. Finally, Level 3 aims to ensure learners can identify a full range of ECG patterns that may present in emergency care, and treat, refer and/or discharge as appropriate. This level is aimed at specialist and advanced paramedics, nurse practitioners, emergency medicine ACPs, and more experienced emergency medicine doctors or GPs. Separating the course into these tiers mean learners can easily identify which elements are appropriate to their level of practice and access the content of most benefit to them. Additionally, each level is carefully designed to correlate with academic levels 4 to 7 and adopts a spiral learning approach for those who do attend more than one. As such, it is the perfect package for educational institutions who wish to provide their students with regular, staged ECG teaching that increases in depth and complexity as the student gains experience and knowledge in practice. In terms of the content, we've been careful to consider a variety of different learning styles when building the course. While e-learning courses have many benefits in terms of accessibility and ease of use, we have found that all too many are fairly static in their learning methods and do not address the variety of learning styles that students may have. As such, each lesson in this course utilises video animations with audio description to provide the fundamental knowledge, and has a discussion board for learners to interact with each other and discuss the content. Each video has associated text containing the full transcript for those with a less visual learning style. And finally, each lesson has a short quiz that allows learners to test their knowledge prior to moving on to the next lesson. Following completion, each level culminates in a multi-choice questionnaire. This assessment is carefully designed to test learners on the learning outcomes they will have covered throughout each lesson, and upon successful completion will generate a certificate for the learner. This certificate will last for 1 year from the date of successful course completion and will be easily accessible from your account page. And all of that content isn't just restricted to your computer. Our courses are all cloud-based and designed to work on a variety of different devices, so you can access the course from anywhere. Just log into your laptop, tablet or mobile and continue right from where you left off. Finally, for those who wish to complement the course teaching, Pre-Med has a number of other learning resources available. Just browse our website to find out about our upcoming webinars, access our webinar archive, or check out our range of medical prompt cards, including our ECG interpretation card. So that's it. We really hope you enjoy the course. If you have any questions or concerns, please email us at sales@prem-ed.com. And please do complete our short survey at the end of the course. We really value your feedback, and we're constantly adapting and improving the course to make it the best we can for our learners. Finally, if you're on any of these social media platforms, please give us a like or a follow and keep up to date with our courses, webinars and other educational activity. So that's it. I hope you enjoy the course. Thank you.